What is familial hypercholesterolemia and high LDL? Imagine a condition that causes your body to struggle with managing cholesterol from the moment you're born. That's what familial hypercholesterolemia is all about. It is a genetic disorder that leads to very high levels of low-density lipoprotein cholesterol, often called bad cholesterol, in the blood. This happens because of mutations in genes responsible for removing LDL cholesterol from your bloodstream. When these genes don't work properly, LDL cholesterol builds up quickly. High LDL levels can cause cholesterol to deposit in artery walls, forming plaques that narrow and harden the arteries. This process is called atherosclerosis and can lead to heart attacks and strokes at a young age. LDL cholesterol is a type of fat that transports cholesterol to your cells. But when there's too much LDL in your blood, it starts to stick to the walls of your arteries. Your liver normally clears LDL cholesterol using special receptors, but in familial hypercholesterolemia, these receptors are faulty or missing. This means your body can't remove LDL cholesterol efficiently, so it accumulates. There are two main types of familial hypercholesterolemia based on inheritance. The first is heterozygous familial hypercholesterolemia, which means you inherit one defective gene from one parent. This is the more common form. People with heterozygous FH usually have LDL cholesterol levels over 190 milligrams per deciliter when untreated. For children, levels are often above 130 to 160 milligrams per deciliter. These levels are much higher than the recommended less than 100 milligrams per deciliter for adults and less than 110 for children. This form increases the risk of early coronary artery disease, but symptoms tend to appear later. The second type is homozygous familial hypercholesterolemia, which is much rarer but more severe. It occurs when a person inherits defective genes from both parents. LDL cholesterol levels in adults can exceed 400 milligrams per deciliter, and in children, they can be over 500 milligrams per deciliter. This form causes early and aggressive cardiovascular disease, often requiring early treatment. Symptoms of familial hypercholesterolemia may not show up early but can include fatty deposits called xanthomas on the skin, especially around the hands, elbows, knees, and ankles. You might also see cholesterol deposits in the eyelids called xanthomas. Thickened or painful Achilles tendons are common due to cholesterol buildup. Some people experience chest pain or angina from clogged arteries, and early heart attacks or strokes can be the first signs. Diagnosing this condition involves measuring LDL cholesterol levels that stay high despite lifestyle changes. Family history of early heart disease also helps in diagnosis. Physical signs like xanthomas or a white ring around the cornea called corneal arcus can support the diagnosis. Managing high LDL cholesterol caused by familial hypercholesterolemia is important because it doesn't respond well to diet and exercise alone. Treatments include medications like statins that block cholesterol production, PCSK9 inhibitors that help the liver remove more LDL, and sometimes procedures like LDL apheresis to physically remove LDL from the blood. Early detection and treatment are key to reducing the risk of early heart disease. Understanding how LDL cholesterol works in familial hypercholesterolemia highlights the importance of screening, especially if there is a family history of high cholesterol or early heart problems. Combining medication, lifestyle changes, and regular monitoring can help prevent serious cardiovascular events and improve health outcomes.